Okay, so I'm gonna vlog really quickly. I'm in my mom's car, different than usual. I hope you can hear this. I got the air on, it's hot, it's 82 degrees in here, and yeah, no way. Am I just gonna sit in here without the air on? So, guess I can take my seatbelt off now that I'm not driving. I just drove from Newton up here to Mercy, where my mom currently is. That's what this vlog is gonna be about. To just kind of let people know and keep them updated. I'm just gonna do this really quickly because I want to get up to her room. Excuse me, I always burp, sorry. So Sunday my little sister called me and said that my mom didn't feel good. She thought maybe something was wrong with her blood sugar. So my mom was just down the street from me, so I got there in a couple minutes and I checked her blood sugar and it was 163, and she just kept telling me she feels dizzy and like she's gonna puke. And so I was just sitting there next to her and she wanted a bottle of water, so my husband went and grabbed her one and handed her the bottle, and she said I need help. And so I thought maybe she needed help getting up to go to the bathroom to get sick, and she like couldn't even open the bottle. And I was like, Mom, do you need to go to the ER? Like, are you okay? And she reassured me she's fine, but like she couldn't open the bottle and she couldn't hold it up to her mouth. And so I held it up, and then she just like was not responding to me. And she was currently watching my 2-year-old niece and had my 14-year-old little sister. So I said, Nate, we need to just take her to the ER. Thank God my husband was off and was there. He had just gotten off work a half an hour before. So I picked up Emmy. I went and took her to my truck. I started it, turned the air on, gave her a book. Came back in, and Nate had my mom out of the chair, and we were trying to walk her to the car, and she could barely move. She kept thinking she was falling. She was like taking baby steps. It literally took us like 10 minutes to get her from inside into the car. Then when she reached her steps, my husband had to pretty much pick her up and carry him down, and because she tried to sit down, she just kept screaming, she's falling, she's gonna fall, she's gonna fall. So we got her close to the car. She starts like exorcist projectile vomiting. We finally get her in the car and we take her to our emergency room, which is questionable. And I called them and I said, can you have somebody meet me outside with a wheelchair? You know, she's not, sorry, I have like a million hairs on my way. She's not doing good. It's gonna take us a while to get her inside. So we got there, went inside. I had Emmy and I had to sign papers for her. I had to call Eliza's work and get her out of there, you know, immediately as fast as she could. She got there probably 25 minutes after we got to the ER. And so Eliza and I were back there. They ran tests. They told us it was a possible stroke. There might be a bleed in her brain. So we were nervous, and she just got projectively worse. She was there, but she wasn't. She didn't lose consciousness, but she was not responding. Her eyes were glossy. She was hallucinating, talking to herself. She didn't remember that her mom, my grandma, passed away 5 years ago. She kept asking for her and would cry when she found out she wasn't here with us. She thought she dropped my niece. She would cry hysterically because she missed church. For 3 hours this went on. They finally gave her some fentanyl and some Zofran to stop the puking, and then they ran testing, didn't find anything. Asked if we wanted to be transferred to Mercy because they have more extensive tests, and we said of course. So right before we were getting ready to leave to go to Mercy, all of a sudden, like a flip of a coin, she made like a, why am I at the hospital? And like came to. She didn't remember any of this. She was upset, obviously, because she didn't remember, and she was like, I don't need to go to Mercy. And we were like, Mom, you don't even understand, like, how scary that was. She's like, I'm going home. And I'm like, no, you're not. Like, you have no idea how scary that was for us to go through that, and you just want to go home, and we can't explain why that happened. Yeah, no flipping way. So she rides in an ambulance up to Mercy, and Eliza and I follow her, and we get up here. She's just exhausted. She's tired. She seems okay, and so, you know, we ended up, she didn't want us to stay with her. She wanted us to go back for Carly, and we were like, okay. So we left at about 12, got home about 12:30. We're back up at 6, up here by 7, and She was fine that whole night and the next day until about 7 o'clock. Not yesterday, but the day before, so Monday. Sorry, it's been a long week. My days were all jacked up. So, she was fine. We took Emmy up there. Emmy was at the hospital for 16 hours that day. Lord, thank you for watching out for us, because she was so good for being 2 years old and being in a hospital for 16 hours. She did really good. So she was fine. She was playing with Grammy. They were coloring in bed. Mom was eating. She was fine. All of a sudden, 7 o'clock runs around. Liza and I ordered some pizza. We were gonna, eat. We were hoping to go home that night. And granted, we still have no answers. We still hadn't. And we were still hopeful that it was just something, that would pass. All of a sudden, she starts going through the motions again. She gets sick, and she goes in and out this time. It's not a steady 3 hours of not being there, but in and out for probably 2.5 hours. She becomes very, like, don't touch me, very just sensitive to movement. I mean, the nurses literally were testing her reflexes and literally did this to her 3 times, acting like they were slapping her in the face, and she didn't even blink. She didn't flinch, nothing. She wasn't, she does this, like, jolt thing every now and then, but it's not steady, and she shakes after she pukes, which is normal, but then it's just like a steady, like, Parkinson's shake. So they're trying to figure out, because they did 1,000,001 tests on her that next day, that Monday morning. They did a CAT scan, they did an MRI, they did an EKG, they did an EEG, they tested her arteries right here, they did a chest x-ray, they checked her spine. I mean, they looked at everything and haven't found anything that could be causing this. And so the neurologist signed off on her. We talked to the cardiologist yesterday. Her heart rate is pretty low. It keeps going clear down to like 39, 40. While she's sleeping, your heart rate is supposed to be anywhere from 60 to 100 beats, and hers barely, she's running in the 50s a lot and getting down to 39 when she's sleeping, which is very scary. There's a word for it. It's bio something. I can't remember. There's been so many names I've heard. I'm sorry, I can't remember. But she basically has a condition where her heart runs a little slower, which is a little scary. So we talked to the cardiologist, and they're doing tests and looking into it. We're basically just trying to check into everything, wondering if it's even stress-induced. She was supposed to have her final day of work at CPI on Tuesday, yesterday, or Monday. I think it was Monday, actually. Monday was supposed to be her last day. She's supposed to be starting a new job today. Obviously, that didn't happen, which is a whole nother thing we had to figure out, of insurance and calling all these places, and that was just another thing added on my plate. They're just wondering if maybe it was stress induced. We're not sure. She's gonna be talking to somebody today about that, and gonna be running other tests. My aunt called me while I was on my way up here. She said she puked again last night, and my aunt's been amazing. She's been staying up at the hospital with her so that I can get back to town, let my dogs out, and make sure Carla's okay and has food. My cousin Brittany's been staying with her too, which is so much help, just because I can't be in 3 places at once right now. So I'm gonna get ready to head into there. We're praying that we get answers, because so far we're up here and she keeps having spells and we don't know why, and she's discouraged, we're discouraged, she's upset, she's tired. She just needs as many prayers and good thoughts as we can get right now. Yeah, so please keep us in your thoughts and prayers. Keep hoping that we get some kind of answer and that we get out of here sometime soon. As long as she's doing this, I want her to be here. She's in the best place she could be. But it's still emotional coming up here every day and not having answers and just seeing this happening. Nobody wants to see this happen to their parent, and it's really been hard on me and my sister, especially because we don't have grandparents. We don't have another parent. Our mom is it. That's all we got. We don't have a lot of guidance and advice and help with all of this. So it's been extremely stressful. I pray every day for some patience and some answers and some, you know, for me, for my anxiety, for peace. It's hard. We're trying to keep everybody updated. I've kept people updated on Facebook, on my sisters. I'll probably do another vlog, you know, in a couple days. Hopefully we won't be here a couple more days, but if we do, you know, I'm just gonna try and keep moving with the motions. This is the first time I've felt good enough to put makeup on in 4 days, and you know, I thought we were getting somewhere. Oh my gosh, somebody just walked by and scared the crap out of me. Probably wondering what I'm doing, but oh well. Just talking to my phone. So yes, I'll keep everybody updated. On top of all this, I have a nutrition appointment tomorrow, and I'm stressed out about that. I wish I could just reschedule it, and I can't. I have to do consecutive months, so I don't even know if I'm going to do a vlog about that tomorrow. Don't want to leave her to do that. I'm scared. You know, my aunt's already missed 3 days of work. I don't know what tomorrow looks like. I'm just going day by day, and Lord help me. So that's it for now. This is way longer than I wanted it to be, but everybody just needs to know what's going on, because I know a lot of people are worried about her, and I just want to say I really do appreciate everyone who's taken the time to message me, call, come and visit. If you want to come and visit, you let me know. We'll figure it out. Yeah, so keep praying for us. Keep us in your thoughts. Let's just get some answers and get my mom back to healthy. So thanks. See you guys later.
Is it, and I'm going to have you sit up here in a minute and maybe you'll be able to describe it a little better when it actually happens. But Samantha, the one that was here yesterday, told me that it was a feeling like you were spinning. So not necessarily like the room was spinning, but that you were spinning, right?
Yes.
Do you, when you get up, like have you been going to the bathroom here? Do you feel like you're on a boat? Is it that kind of feeling when you're up on your feet at all?
I never thought of it like that. It's weird walking.
Okay.
For one, just because I've been like, you know,
Well.
I'm usually a go-getter.
Right.
I mean, I work third shift, being operator, and I'm always on my feet. I'm always moving.
Okay, yeah.
And so it's kind of difficult to be sitting down like this and to explain, like, you know, just how it feels and what it is. Fast movements, I get dizzy.
Okay. But if you move slow, it's better.
It's better, but it's still there.
Still there, but better.
It's
Okay.
weird. Like, it's yesterday especially, like if I would have looked left and then I would come right, it was like really bad. And it would just like, I mean, I would be dizzy like the whole time I was moving.
Is it, so you're laying down, so the head is in more of a horizontal position. Does it also happen when you're sitting up?
Yeah.
So the same head turns.
Yes.
So it doesn't matter if you're laying down or sitting up. Okay. So I'm going to do probably some of the similar tests she did with you yesterday, just so I can kind of see the results for myself, because the way she was describing it to me, she's like, oh, you know, the patient said this, I saw this, you know, and it's easy, you know, I can read it on paper, but it's not, you know, like unless I see it, it's hard for me to determine is that really what I'm seeing there, and then I have an additional test.
What?
You take this cover off.
Yeah, but before I do those, basically before I make you dizzy, I would like to see you walk, like noticing with one side or the other, if you tend to like veer to one side. You know, I mean, like there's little nuances that I kind of look for, and I want to do it without, you know, or before I actually do all the head stuff is probably going to make you dizzy. So, which side is better for you getting out on? First of all, you definitely have some tight musculature, mostly I'm guessing associated with that you've been trying to stay stiff as a board and not move your head and not do anything, and so all of your postural muscles are all very tense. You do have actually a rotated vertebra. That's almost all of us do. That's not an uncommon thing, don't worry. But I mean, something that can, you know, it's going to affect things going up and can affect things going down. And if you're already having some problems trying to hold things in, that can just be exacerbated as well. So that'll hold them down. That's something that's going to take. You could see a chiropractor, you could see a masseuse, massage therapist, you could see a physical therapist. Like all of that would be some things that I would do outpatient. Though I mean, you don't need to stay in the hospital for that. So you can go for a couple of visits and get things, better aligned, get the muscles, get some massage, get some deep tissue, whether that's ultrasound or heating or something like that done.
I'm trying to go with you and shake my head.
No.
It didn't work.
No shaking of head. No shaking of head. I get it. So, all right. Now I'm gonna do the tests which she had done yesterday, where she had you lay back and like with your head. So just stay sitting because you're having the tension part of the headaches from all of this neck tightness and all of that. But you also are probably having that vestibular migraine and this what's called benign paroxysmal positional vertigo. Say that 10 times. And they can address all three of those things. They can address muscle tightness, they can address the migraine. Hopefully we can get you some medication that will help with the migraine first off. They can address that even with stretching and things like that to help increase blood flow. And then the actual BPPV, that inner ear thing that's going on, they can do the treatment that I just did is the gold standard for treatment for that. But oftentimes you have to do it more than once. The first time doesn't always take. Because what's going on in there is things are kind of out of place. So we use gravity to help, we do a series of movements to pull those things back into place. But unfortunately, if every little piece doesn't go back where it's supposed to be, you have to do it again and again and again until they're all, back where they're supposed to be. Have you ever had physical therapy before for anything? Okay. Do you live here in Des Moines? And where do you live? Oh, okay. So Skiff is there. There's probably multiple other outpatient physical therapy clinics in the area, Athletico or physiotherapy or something, probably, right? What I'll do, I'm going to talk to the nurse. I'm going to get you a script for outpatient rehab. Normally I would say have them put vestibular rehab, but I want them just to put outpatient PT so that they can address everything, because I don't want them to be limited.
They gave us a script already of something. I'm not sure what exactly it is.
Perfect. Yep, that'll work because it says outpatient PT for vestibular, but it also gives them just the outpatient PT, so that will work. And if you can kind of describe to them what I've told you about some of the muscle tension and blood flow, possible blood flow issues. Of course, I can't say it's a blood flow issue because I'm not, I didn't do a test, right? Oh, I can, yeah, I can do that.
That would be good.
Yes.
Yeah, we got all the paperwork in here, so.
Perfect, yes. So that script is good for 30 days. You can make your own appointment. So find a day and a time that works for you, a clinic that's close to home or whatever, and you can make your own appointment. That script is good for 30 days. So whenever you can get to it. I would say as soon as possible, obviously, would be best, and I'm sure you would agree with that. But you can do that. And then let me write down the couple things that I've seen, so you can hand those to the therapist, and that'll get them on the right track a little faster at least. They'll still do the test again, because like I said, just like with me, they're going to want to see the things, for themselves and feel and everything like that. But I think we definitely have what's going on here. We just got to get it calmed down. All right, I will go let the nurse know. I will go write those things down, and then I think you're okay to get out of here. So I'll go.
Yay!
Your ride? You got something?
Yeah.
They can drive you? Okay. All right, I'll get this going.
Thank you. That totally makes sense now. A lot more than just trying to pin it on vertigo.
Can I have my water?
Yeah. Makes a lot more sense though than trying to pin it on just vertigo, because
But you got all that, what she said?
yeah, I have it on video. So I'm home now. I'm super sweaty, super hot. Oh, it's been a long day. So mom is home officially. We got released from the hospital at about 3. The physical therapist came in and the psychiatrist came in. They both were the final doctors to release her. And I'm really glad that the physical therapist came in, because she's somebody who specializes specifically in like head dizziness and stuff. So she came in and she did some tests on mom and figured out that with her symptoms she's having, they have mentioned vertigo, and on top of that, she has this vestibular, I think it's called, basically a vessel in her head that is like having a severe migraine, and it's like opening and shutting. It's like an artery, and basically it's causing her to lose oxygen to her brain, which is causing her not to remember and her to basically not respond, act like she's not there. They gave her medicine to help with the dizzy and the nausea, and she's just supposed to take ibuprofen, Tylenol for the headaches. We're supposed to follow up with the primary physician, and hopefully she will be starting her new job come beginning of August, depending on how well this goes. She also is supposed to be following up with a physical therapist. Basically, they work with gravity, and the way she explained it is stuff gets moved around in your head, and they use gravity to kind of put it back into place. And mom thinks that this happened because she had a really bad fall at TPI like a month ago. Landed flat on her back, and think something got frazzled there. So with that being said, she's home. I was at her house for hours after we got done. It's about 7 o'clock now. And we got home about 3:30. I made her some dinner, and Carly's keeping a close eye on her. But she's been doing a lot better today. I went and got her meds all picked up for her, so she is good to go. Once again, thank you to everybody who took time to message us, to pray for us, and to just help us out. Eliza and I appreciate it a lot. So from here on out, let's just hope no more episodes, and let's get this fixed. So thanks for watching. I took my hair down so I look even more like a hot mess, but I forgot to say that we panicked. It was scary. They were really thinking that it was seizure and stroke and all that, and I'm relieved that it is minor, but at the same time that was scary. I didn't know what was going on. The tests were coming back negative. We're like, what the hell? Something's got to give. So, we really just, stuff like that's scary. I just want to remind everybody, like, each day is a gift. Like, tomorrow's not promised, and I just want to say a huge thank you to Mercy Hospital and all the awesome doctors and nurses we had who were patient with us, who listened to us, who listened to our concerns, who helped take care of mom. It's scary to learn that your parent might have had a stroke. Am I relieved she didn't? Oh yeah. And it was extremely frustrating because they wanted me to leave with, oh, she has vertigo. Okay, vertigo doesn't cause what was happening. So I'm super just like so thankful that it was just a migraine, because I was like, there's no way vertigo causes that. And she says this vestibular thing can cause stroke-like symptoms. And I'm just like, I just feel like I was crazy. But I'm really glad that it's not a stroke, and that it was just stroke-like symptoms. So once again, I forgot to say thank you to Mercy, and I just wanted to remind everybody to live each day and be thankful for it. Yeah, so I promise I'll stop now. Bye.